These are the results of one of my recent YouTube polls, asking you, my faithful YouTube audience, about the things that make your tinnitus worse. And if you look closely, you'll notice an obvious pattern between them all. Any ideas? You may have noticed that none of them have anything to do with your ears. Now, don't you find that a little strange? The reason for this is simple, and that's because there are two different types of tinnitus. Number one, that originates from your ear, and number two, that doesn't. And today you're going to learn everything about both of them, along with the best tinnitus treatments for each. So what exactly is tinnitus? In its most basic form, tinnitus is the perception of sound or various sounds in one or both of your ears, or even from somewhere within your head, which isn't being produced by something that's present in the environment around you. And it is way more common than you realize, with 10 to 15% of the US population alone reporting that they have some form of tinnitus. Whilst there are many different layers to tinnitus, if we really break it down, it can be categorized as originating from one of two main places. And that's either peripherally or centrally. Peripheral tinnitus originates in your ear and is specifically caused by issues within your auditory system as far as the cochlea. It's typically caused by issues that will directly affect your ears, and there are four pretty common conditions that can cause it, so let me know if you suffer with any of these in the comments beneath today's video. First of all, earwax. Yes, as ridiculous as it sounds, I regularly see a ton of patients who are experiencing tinnitus, and of course, the first thing that any audiologist will do when someone sits down in their room is thoroughly examine their ears. And you know what? I love it when I come across an earful of wax with someone worried about tinnitus because it's the easiest form of tinnitus to treat. A few minutes of performing either microsuction or irrigation, and voila, this may well eliminate your tinnitus. Today's second causes of peripheral tinnitus are infections in the outer or the middle ear, also known respectively as otitis externa and otitis media. Now, it is possible, but not always the case, that they'll cause pain, inflammation, and/or a fluid buildup behind your eardrum. And as a result, this can also interfere with your hearing in either your outer or your middle ear, which can again lead to tinnitus. This leads me on to the most common cause of peripheral tinnitus, which is hearing loss. And other than a hearing loss caused by infections, there are other causes too, such as an age-related hearing loss, which is just general wear and tear, known as presbycusis, or even a noise-induced hearing loss, which, believe it or not, is 100% avoidable and caused when you're exposed to loud sounds and don't wear any hearing protection. This can be whether you're partying, whether you've done some shooting, or working in a particularly noisy environment. Now, before I move on to the central causes of tinnitus, I have one more common cause of peripheral tinnitus, which is something called Meniere's disease. For those of you that haven't come across the condition before, it is a pretty horrible thing to experience. And you'll know if you've got it due to the very specific symptoms that one experiences when you've got Meniere's. These include vertigo and dizziness, hearing loss, and then the subject of today's video, which is obviously tinnitus. It's caused by endolymphatic hydrops, which is an abnormal buildup of fluid pressure within your cochlea. Quite differently to peripheral tinnitus, central tinnitus is thought to originate from within the auditory centers, when the tinnitus-related activity does not pre-exist within the cochlear nerve. These different types of tinnitus require different types of treatment, which I'll come on to shortly as well. Now, one thought behind central tinnitus is that it appears due to the lack of stimulation that presents with a hearing loss. The theory is that if the auditory system is deprived of normal input, the central auditory pathways undergo changes, with neurons in the auditory cortex becoming hyperactive and hypersensitive, leading to the perception of tinnitus. For me, one of the fascinating things about this is that this hyperactivity is often exacerbated, making your tinnitus worse. And this is done if you A, focus on your tinnitus, or B, experience anxiety or stress, demonstrating that tinnitus is therefore worsened by your emotional state, with studies showing that the areas of the brain involved in emotion, such as the amygdala and also the limbic system, play a crucial role in central tinnitus. which explains fully why stress and anxiety can intensify your perception of your tinnitus. There is some incredible research in this field demonstrating that central tinnitus can involve changes in the spontaneous firing rate and synchrony of neurons in the auditory pathways. This has been demonstrated using functional MRI and PET scans, showing increased activity in the auditory cortex and limbic systems for those out there with tinnitus. Again, fully supporting the idea that tinnitus is not just an ear issue, but also a brain issue. Of course, when thinking about the best treatment for your tinnitus, it's important to understand where yours originates from. Is it central or is it peripheral? For peripheral tinnitus, you have to start by treating your ear condition, and for central tinnitus, it's important to focus on managing your stress, anxiety, and cognitive response to the tinnitus, and then any other elements that will contribute towards them from within your life. Now, that isn't to say that this is a one-size-fits-all approach, and I will say that there's also definitely a crossover between these treatments too. Now, it's safe to say that these are the easiest issues to treat. For example, removing earwax if you have an earwax buildup, taking antibiotics, antifungal medication, or sometimes surgery if you have an ear infection, being fitted with hearing aids if you have a hearing loss, or managing a vestibular disorder with the most appropriate treatment for your particular condition. In my opinion, treating central tinnitus can be far more complex and may often involve a multidisciplinary approach. I personally have a team of audiologists specifically trained in this form of hearing therapy, and they focus on 3 key areas. First of all, starting by focusing on stress management techniques, either using cognitive behavioral therapy, mindfulness, meditation, or relaxation exercises, or even a combination of all of those. They are well researched as being the most effective treatment for tinnitus, helping you to manage the emotional aspects of your tinnitus. The second area of focus involves sound therapy treatment, and this can be done using different types of noises, whether that be white, brown, pink, nature sounds, or even wearing hearing aids to fill the void associated with a hearing loss, all of which should technically help to mask the sound of your tinnitus. And then finally, in cases where the first 2 phases haven't helped, medication may be necessary to treat your anxiety or depression, and can help to suppress the negative impact that your tinnitus is having on you on a daily basis. If you are experiencing tinnitus and this is the first video that you're watching, then you are 100% doing the right thing by taking control and looking at what you can do to be able to control your tinnitus. Of course, the thing is, YouTube can only give you so many answers, and it's crucial to get a proper diagnosis to determine whether your tinnitus is central or peripheral. Now, like I said earlier, there is no one-size-fits-all approach for managing your tinnitus. But if you want to know the essential things that you should cut out of your life in order to overcome your tinnitus, then you have to watch this video, which has had over 250,000 views already.